Warm welcome to today's talk. It's Thursday the 24th of February, and of course today is a very sad day for the free world everywhere. But in terms of the pandemic, it's a more encouraging day. Now let's start having a look at some data from the United States before we go on and look at the latest Office for National Statistics data. So this is just from the United States, just to give us an idea. So there was 84,000 cases yesterday, but that's down 66% in the last 2 weeks. So a very significant downtrend in cases, and these are the ones that are diagnosed. And we do believe that these represent infections as well, because hospitalizations, 54,000 people currently in hospital, again down 44% on the last 2 weeks. This is remarkably encouraging. Now, deaths were still high. Yesterday there was over 3,000 deaths in the United States. This is higher than the average. I think the rolling average for the past 7 days is about 1,900, but it's still quite significant. The deaths are going down painfully slowly in the States, but they are going down. 26% down in the last 2 weeks. Official death toll from COVID is 940,000. And the excess deaths in the United States during the same period are well, during the pandemic period, well over 1 million. So the United States has suffered a lot in terms of people that have died. Just an example from New York City, 1,000 cases, down 3% on the day, 1,055 cases, down 56% in the last 2 weeks. So it's all looking promising. Deaths down 62% in the last 2 weeks. New York a bit ahead because that suffered or was exposed to this variant, the Omicron surge, earlier than other parts of the United States. Now, I don't want to exaggerate, but at least a year now we've been saying that the vaccine interval in the United States is too close together between the first dose, the primary dose, and the booster dose. And the CDC, on the quiet, have just slipped this in now over the last couple of days. This has been so obvious for so long, and yet the guidelines from the Centers for Disease Control changed 2 days ago. We have been talking about this literally for a year, if not more, on this channel. It's just so obvious. So, consideration for interval for mRNA COVID-19 vaccine primary series. Check it out. These are the sites. That's the overall site. That's the specific site where I got these quotes from. That's a sort of a subsite of this site. An 8-week interval may be optimal for some people aged 12 years and older. And then you go on, especially for males aged 12 to 39 years. We've been saying this for so long now, and they've finally done this. How many cases of perimyocarditis have slipped through because of the tarded response from the Centers for Disease Control to correctly, or more correctly, space the vaccine doses? Absolutely incredible. While absolute risk remains small, they say, the relative risk for myocarditis is higher for males aged 12 to 39 years. And in fact, in the days of Omicron, I'm going to show you data from the UK shortly. Really, the risk-benefit analysis has now completely changed, in my view, as herd immunity develops. Whether you call it herd immunity because it's leading to endemicity, doesn't matter what you call it. The fact is that nearly 99% of people have been exposed to this virus now. In the UK, the risk-benefit analysis for young men in terms of vaccination has changed. That's all I can really say about it. The risk-benefit analysis has changed. And this risk might be reduced by extending the interval between the first and the second dose. Well, given that most of the vaccines that are going to be given in this pandemic have already been done, this is a clear case, an appalling case really, of bolting the stable door after the horse has itself already bolted off. Okay, it still benefit a few people. There's some people still getting the primary and secondary dose in the States, but the vast majority have had it, and now belatedly the CDC comes into the light. We've been saying this for so long. Peak antibody response and vaccine effectiveness may be increased with an interval longer than 4 weeks as well, as we've been saying. So longer gap, 8 weeks, now recommended 8 weeks, probably going to almost certainly going to somewhat well, it will reduce the risk there. What are they actually saying there? Well, the absolute risk remains small. The relative risk for myocarditis is even higher in males, and this risk might be reduced, they're saying. So again, they're still being very cautious, and there's no apology for having got it wrong all this time when on this channel the data was clear. And of course we on this channel have nothing that's not in the public domain. This is nothing that anyone couldn't really have worked out, but there you go, better late than never. Now Europe, cases are going down. So Poland, for example, lifting nearly all the remaining restrictions on the 1st of March, so just a few days time. And of course we lifted all legal restrictions in the UK as of this morning. Thursday is our first day where there's no legal requirements, not even to isolate. Prime Minister of Poland, deaths and hospitalisations, Omicron variant lower than anticipated. So Omicron has been better than they had hoped in Poland. Encouraging trends make the risk of shifting to an endemic approach worthwhile. So again, clearly shifting to an endemic approach, as in England and Scotland and Wales, I think are falling on fairly soonish. They always like to do things a little bit differently. Cases, just over 20,000 new cases for the day in Poland, but that's down 30% on the week. So again, we see this encouraging reduction, and this is despite people having 2 doses of vaccine in Poland is only 58%. So again, we're seeing the massive immunity effect being generated by Omicron exposure. Germany, likewise, 20th of March, most of their restrictions are going to go hang on a bit longer. Now, Her Majesty the Queen in England, I'm not saying this is a concern yet, but Her Majesty is 95, so she is in a higher risk category, and she's cancelled online activities, virtual events, yesterday and today, I think. So Her Majesty obviously feeling a bit under the weather because she doesn't cancel things lightly. So, of course, we wish her the best possible outcome. Now, week ending the 19th of February, I'm going to go on to the Office for National Statistics data now, but week ending the 19th of February, okay, it's a bit out of date, it always is, but 1 in 25 people in England had COVID, 1 in 30 in Wales, 1 in 14 in Northern Ireland, and 1 in 20 in Scotland. There is still very high numbers of COVID about. Now, the numbers from the Office for National Statistics are high, as are the numbers from the COVID symptom tracker study. The official numbers, which are based on testing, are much lower because a lot of people are no longer reporting their lateral flow tests. So the numbers appear the cases are low officially, but the infections remain higher. And so as we see in England, 1 in 25, 1 in 14 in Northern Ireland, so still pretty high. And we'll give some possible reasons for the Northern Ireland one. Maybe not just now, but it could be because of BA2, the more transmissible Omicron variant. But looking at the overall, this is for the UK. So infections decreased, so they're down. That's good. Hospitalisation admissions decreased. Deaths decreased a little bit. Not a lot, but a little bit. Around 8 out of 10 adults have had 3 vaccine doses. 99.5% of people testing positive for antibodies. Now, the actual people that have been exposed to vaccine in the UK is about roughly 92%. I think just under 93% actually. So this means the rest have been exposed to the virus because the antibodies are essentially now universal. There we go. Virtually everyone in the UK has been exposed. 0.5% have not. Social distancing is going down, and we could argue that this is a remarkably good thing because it means that that Omicron is, as Omicron spreads around, it's going to increase the amount of immunity that it leaves in its wake. So, for example, data here on cases, England, percentage of people. This is percentage of people for the whole population going down as the immunity increases. Scotland's still going up. Now, Scotland did have more restrictions for longer than England, so it could have been that that just delayed everything a bit, and that's what we've been advocating on this channel, that if you haven't been infected with Omicron yet, you probably will be. So for me, personally, I would prefer to get it while my vaccines are still effective. So far, I'm still testing negative. I actually had a bit of a cold and didn't feel too bouncy today, but there we go. Still negative, so that was me today. I haven't tested positive yet. Very strange, but there you go. I think it's probably, I mean, I've obviously been exposed to Omicron, just didn't get it. So because I've had 3 doses of vaccine, there's about a 56% level of protection or something. For I think it's about 56%, as we looked at yesterday. So you know, there's a 50-50 chance I won't get it, or I'll get it, but I won't be symptomatic. And then of course, if you were, what that means is I could well have been infected in between tests, because I only test if I feel a bit ropey, so or I don't feel quite bouncy, and could well have missed it. We'll have to get some antibodies to find out, but there you go. Now this is quite a useful screen. It shows us the infections, the hospital admissions and the deaths in the time period. Older people, more protected by vaccines, don't socialise as much. Younger people, higher levels of infection, as you might expect. Hospital admissions, of course, still heavily skewed towards the older age group. Now, there is a slight increase here in the 0 to 4s. Small, but I do believe that this is mostly precautionary, as nurses and doctors are very cautious with children, of course. At that age, they're pretty... They can often need observation, and they can deteriorate really quite quickly. So we tend to admit under that age group sometimes as a precautionary principle. Because we looked at the data from multisystem inflammatory syndrome in children from the United States, and since the Omicron variant has started, that has gone down pretty well consistently, and reports from around the country are showing that with Omicron there seems to be a lot less multisystem inflammatory syndrome. So that is good, even though that looks a little bit disconcerting there. And deaths, again, likewise, are completely skewed towards the to the older age groups, as we would expect. So hospital admissions involving COVID continue to decrease, again for the period that's always a bit behind from the Office for National Statistics. But we see, so January into February, so that's probably about February. What's it up to? It's up to the 13th of February. So I mean, definite downward trend in hospital admissions. This is good news. We are coming out of the Omicron wave. Long COVID, though, is a bit of a concern. Now, these are people that are still complaining of symptoms or tiredness or just not feeling right after 12 weeks. And this is the situation. The cases have been going up, so you probably can't see that. But these are the weeks down here. So this is the latest data we have here, up to the 2nd of January 2022. And we see 1.3 million people are currently complaining of long COVID. The numbers are high and they are increasing. That's a problem. And it's just really the burden of morbidity. A lot of people off work and can't care for children and just can't attend to their normal duties. And I can't remember the exact figure, but probably about half of those have been symptomatic for a year, which is a massive concern, because a lot of people still don't know what trajectory they're on. Now, this screen's useful. This is the effect of 2 vaccine doses were associated with a decreased likelihood of self-reported long COVID. So this line here would be people that are unvaccinated, and here we see lowering reduction. So this is combined. So we see people that have had the mRNA vaccine, they're about half as likely to get long COVID. For the Oxford AstraZeneca, slightly a reduction, but slightly less, of about 0.3, something like that. So about half as many people getting long COVID after 2 vaccines compared to those that are unvaccinated. But of course, the effect of the vaccines is waning as we speak. Now, this is the number of people. This is when COVID-19 was the underlying cause of death here. So if we look at the latest data, and this is for England and Wales, adjusted for population, so we see that it's around about 75% there. So that means that 75% of people that have died with a COVID diagnosis died because of the COVID. But that also leaves 25% of people that didn't. So in 25% of people, you could say it's maybe to say it's an incidental diagnosis is too strong, but it wasn't the main thing on the death certificate that resulted in deaths. But what it means is when we look at the death figures, 75% of those people would still be alive if they didn't have COVID. But we also need to remember that the average age of a COVID death in the UK is about 82 years old. So this is, of course, mostly in the older population. And then when we look at the comorbidities, so this is deaths in England with comorbidities who've died of COVID, and this is percentages here. So we see that the most common one is diabetes, just here, and all the indicators are showing that the better controlled the diabetes, the less the risk. So, but having said that, people with good controlled diabetes do seem to be dying as well. There seems to be some intrinsic increased risk. Then it's chronic lower respiratory diseases, these comorbidities that we've not talked about for a long time now. High blood pressure, diseases of the urinary system, poor blood supply to the heart muscle, ill-defined conditions, dementia and Alzheimer's disease, heart failure and complications of heart disease, cardiac arrhythmias, where the heart is not beating in a regular sinus rhythm, malignant neoplasms of lymphoid hematopoietic, and so these are blood tissues, and these are people that have died of COVID where there was no pre-existing conditions listed on the death certificate, which has been fairly constant at about 17%. So definitely some people dying without comorbidities, but most of the people that were dying had comorbidities. So that's the comorbidity data that we've been looking at actually for a long time as well. I think just before we go on, we'll just look at deaths as well. So this is this is more on deaths here. The risk of deaths involving COVID-19 was estimated to be 67% lower from Omicron related to Delta. So we're seeing much lower rates. So this would be the line here for Delta, and we see 67% less chance of dying from Omicron. This would be Delta here. Men 75% less, women about 58% less. So very much lower rates of death with Omicron compared to Delta, as we've suspected for some time, or as we've known for some time. And these are the age groups. So again, this would be Delta, this is Omicron. So younger, 18 to 59, 60 to 69, much lower rates. Slightly less benefit from the older age groups. So that's Delta. That is that would be the Omicron figure there. Here we have the age standardised mortality rates, and this goes right back to March 2020 through to January 21 there, and we see that in the basically this was the original wild type. This was the alpha wave. Here we had much better treatment and vaccination for the Delta wave, and in the times of Omicron we do see a slight increase, but as we've seen, that is already starting to go down now as the wave starts to pass. And here we see that. So original wild type wave, alpha wave when vaccines and treatments were low, Delta times when vaccines and treatments were much better. Definite increase in Omicron because everyone's been getting it all at the same time, but now definitely going down, so looking pretty hopeful. And people who've had 3 vaccine doses are at a low risk of death involving COVID-19, and as we see, most of the protection is in the older age groups. So my question is, has the risk-benefit analysis changed now in younger age groups, particularly with younger men? Because as we've seen, they are at such a reduced risk from Omicron, as we've just seen in the previous graphic. Now this slide is Office for National Statistics data rather than COVID symptom tracker data, and it's comparing the symptoms with Delta and the symptoms with Omicron. So we see that loss of taste is much less common with Omicron compared to Delta. Loss of smell, of course, taste and smell go together. Fever, slightly less common with Omicron. Cough, again, slightly less common with Omicron. On the Office for National Statistics data going on, shortness of breath, again we see the difference. More shortness of breath with Delta, less with Omicron. Sore throat, more sore throats with Omicron. Fatigue and weakness, more fatigue and weakness with Delta, but still quite a lot with Omicron. Headache, again slightly more with Delta, but still a lot of headache with Omicron. Muscle aches and muscle ache, myalgia is just muscle ache. So much the same there really between Omicron and Delta, maybe well slightly more with Delta but not a lot. Abdominal pain, again less common with Omicron. Diarrhea, less common with Omicron. And nausea and vomiting, slightly less common with Omicron. Consistent with an overall milder picture altogether really. And asymptomatic people here we see slightly more asymptomatic with Omicron compared to Delta at just over 40%. And of course the other big thing with Omicron is we're getting lots of reinfections, which has risen sharply. The reinfection rate increased from 11.7 to 141 per 100,000 people. And that's looking at the whole population, of course, but we do see that 10 times more people, or roughly 10 times more people, are being reinfected with Omicron compared to the relatively small number of reinfections with Delta. But of course these are boosting the immunity, and the vast majority of these reinfections are incredibly mild. The vast majority are incredibly mild. The risk of reinfection was 10 times higher with the Omicron variant, yeah, compared with the Delta variant in that time period, during its own time period. People who had their second vaccine dose over 90 days ago were more likely to be reinfected than people who had it 14 to 89 days ago. Again, showing that the vaccines are indeed waning. So that's a bit of a tour de force of quite a lot of data sets today. It's looking promising. I believe the Omicron wave is going down, and by the time the better weather comes I expect it to be really quite low. We'll then enter a period of endemicity that will last for quite a few years, maybe indefinitely, when we are continuously reinfected, nearly always with asymptomatic or very minimal symptoms. And the community immunity will be maintained over this period of endemicity. And the big problem that COVID has been will basically go away for most places. We already know it's essentially gone from Uganda, where we've got good coverage from, and that's not because of vaccination, it's because of natural infection and natural acquired immunity. So, quite hopeful, and of course, as most of you have noticed many times, Winston's taken his mask off. He just doesn't think it's necessary anymore. This is because I sprayed some glue on him, so it's not that he's a dirty dog, he's not, he's actually very clean, it was my fault. So sorry about that. Okay, that is us for today, thank you for watching.